and he started hitting his head on the side of the cell wall there on the concrete cinder blocks. And kept hollering that he just wanted to kill himself. He wanted to die. Right now, he's huddled up in a corner with the blanket on top of him, away from everybody.
In Del Norte, Colorado, rural Rio Grande County, Undersheriff Ed Rapp says this is how his department tries to keep a mentally ill person safe.
He assaulted a family member and possibly had stole the gun.
The man was tracked down without incident, and deputies knew he was in crisis.
We ended up taking him up to Denver.
You had an M1 hold?
On an M1 hold for 72 hours.
The undersheriff never really knows where there might be an open bed for such mental health services. Occasionally, it could be at the state mental hospital in Pueblo, but more often, it's a private state-contracted provider in Colorado Springs or Denver. In this case, the provider called to tell him
that they're going to keep him for a few more days because he just tried to hang himself.
Several days later, the man was finally brought back to the county jail.
And then right away, he's threatened to commit suicide, and we caught him trying to hang himself again. Then we give him what we call a suicide blanket. We give him that blanket, got him calmed back down, and he'll be that way until we can figure out what else to do with him. Our facility is not set up for mental health.
How many times has this person been in your jail for mental health issues?
I don't know.
A lot?
A lot. He's a frequent flyer.
Is he the only one?
No. No, we have several.
The Rio Grande County Jail has just 2 holding cells where prisoners can be restrained, but they have no padding, no helmets to protect out-of-control mentally ill inmates, and not enough time, money, or personnel to help them. There's no hospital, there's no emergency room?
No, none. We have to take them and transport them all the way to Denver.
And that's on your dime?
That's on our dime, and generally, whenever a person is mentally, has a mental health hold on them, we're going to have 2 officers do the transport. When that happens, we're either short back in our jail or we're short on the road.
The undersheriff argues that each geographic region of the state needs some type of treatment center where the mentally ill and people in crisis can get help, and he knows the major impediment is money.
It would save us from having to drive 5.5 hours one way just to drop off a mental health issue. Even if it was as far as Alamosa, 30 miles away, at least it's doable.
As it stands now, the man being held here must be evaluated to decide if he's competent to stand trial. If he's not, he must then receive treatment, but only if there's a mental health bed for him.
If not, we have to wait until it comes available again.
And that means he could be right back here waiting for treatment in Denver, Pueblo, or elsewhere.
It doesn't matter whether you're San Luis Valley or if you're out on the Eastern Plains. The small rural counties, we don't have the facility, we don't have the money, we don't have the expertise to turn around and to deal with mental issues like this. We're trained for public safety, trained to help people, to protect people, but we're not psychiatrists.
And Rapp says he's not the only one that should be upset, because the system is simply not fair to people with mental illness.
He should be seeing a psychiatrist daily. He should be on probably some medication to keep him leveled out to where he don't want to hurt himself or hurt somebody else. But it don't happen down in rural areas.
And you're stuck with it.
And we're stuck with it.